I got a copy of H.R. 944. Do you know what it is? It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office.
I now recognize the gentlelady from Michigan, Ms. Stevens.
Well, thank you, Mr. Chair, for holding this hearing, and Mr. Secretary. It is, in fact, true. I come from the great state of Michigan, and as you enter your second year as our nation's Health and Human Services Secretary, I just had a few things I wanted to tick through with you here today. So in early 2025, after your confirmation, measles cases spiked in the United States to the highest level since 1991. Last year, we had over 2,200 cases in America. 3 people died, 2 were children. Do I have that correct? Because according to the CDC and the American Academy of Pediatrics, I do. During this same time,
that epidemic started before I came
during
into
this
office.
same time, you questioned the effectiveness of the measles vaccine. And then in September, your hand-picked vaccine panel voted against recommending the combined measles vaccine for children under 4. This is true?
It was dangerous.
We know now that
particular
over
version.
90% of measles cases in 2025 were among people who were unvaccinated or whose vaccination status was unknown. That's correct? According to the CDC,
we should have given a dangerous vaccine that all the science
in just the first 3.5 months of 2026, the year we're in right now, we've already seen an additional 1,700 measles cases. I assume you're aware of this, according to the CDC.
There's a global epidemic.
You have also pushed vitamin A as a treatment for measles. That is correct?
Yeah, every
According
major
to
health
the America's
organization in the world
Poison
recommends
Centers,
it.
vitamin A overexposure among children increased by nearly 40%. And in this time frame, children in the hospitals with both measles and unsafe levels of vitamin A has occurred, correct?
I'm not recommending unsafe levels. I'm recommending what every major international health organization recommends.
The American Poison Centers agrees. You characterized your response to one outbreak in Texas as a model for the rest of the world, even as the number of measles cases climbed. As Secretary of Health and Human Services, have you ever taken steps to undermine medical guidelines rooted in science? Because we can look at your record, sir.
Oh,
I serve on the Science Committee. At the beginning of this year, the CDC tried to slash the childhood vaccine schedule from 17 recommended vaccines to 11 before it was blocked by a judge. Hepatitis A, B, RSV, multiple vaccines were demoted. Do you dispute this charge, sir?
You think that we should recommend interventions that have not been safety tested?
Have saved countless lives. A 2024 study estimates that childhood vaccines have saved 1.1 million children's lives and prevented more than 500 million illnesses in the last 3 decades. Doctors, researchers, and medical experts have spent years working to not only understand illnesses, but also prevent them. Your actions restricting these vaccines have a grave impact on our country. And while you have waged war against established medical science, you've also attacked life-saving research on cancer and Alzheimer's. You have implemented measures that have raised costs, kicked families off their insurance, and made it harder to get coverage.
You're just
devastated rural hospitals. Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is? It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office. I yield back.
The gentlelady's time has expired. I now recognize the gentleman from Missouri, the good Dr. Under.
Thank you, Mr. Secretary. Thank you for being here. I'm glad my colleague got her little X clip there. Hopefully it'll go viral for her like she intended. Secretary, thank you so much for your work on just so many areas. But one of the things I wanted to highlight today was your work on prior authorization that was used too often to deny patients of the care they need. But I think what we're seeing, I'm a practicing physician, practice very little now that I'm in Congress, but now more and more we're seeing threats to patient access because insurance are allowing doctors to give patients the care they need, but then denying payment for those cares. And this isn't the usual, fight over physicians getting reimbursed. An example from my own specialty, I've been contacted by dozens of allergist immunologists around the country that United Healthcare is claiming to follow Medicare, dishonestly claiming to follow Medicare on allergy immunotherapy and reimbursement, allergy shots, and completely denying care for that very life-changing, reimbursement for that very life-changing treatment. Given the market power of United Healthcare, this will put this particular therapy out of business within, I would say, 6 months to a year if UHC's policy continues, for 45 million United Healthcare insured patients. So I think we need to watch that, not only the barriers to care up front, but if insurers can arbitrarily use their market power to deny reimbursement, that care will go away likewise. But, yeah.
Yeah, I mean, I have children with anaphylactic allergies.
Yes.
And some of them have benefited from these, these allergen medications. I have a son who literally lost his peanut allergy, which every doctor told him.
Yeah, that's oral immunotherapy.
It never happened.
Yes. That's oral immunotherapy, which is relatively new, and I don't think any insurer actually reimburses for that. And then aeroallergen immunotherapy, pollen, mold, dust, and so on, that used to treat asthma, sinus disease, allergic diseases, is mostly what United right now is.
This is the first I've heard of it.
Yes.
So, and I have two guys who are sitting behind me, Chris Klump and Ken Callahan, who will be interested in helping you with this. Let's get them together with your staff.
I appreciate that, Mr. Secretary. And I want to commend you, and my colleague, Representative Miller, highlighted this, your work to protect kids from mutilating transgender procedures. Of course, I think most impactful, immediately impactful, was the denial of Medicare and Medicaid reimbursement to hospitals who insist on mutilating kids, despite the science, including the recent Finland study. But one thing that really just monumental development, I think, is the executive order that President Trump transmitted last January. It had a number of components, including directing the HHS study that came out later last year, but also directed the Department of Justice to work on a bill to create strict liability for those healthcare providers who would exploit our kids with mutilating transgender procedures. I am honored to be carrying that bill in the House. It's the Chloe Cole Act. Senator Blackburn is carrying in the Senate. I believe that strict liability, the ability of parents and children, young adults, to hold those who exploited them with these mutilating procedures accountable could be very impactful, just as we saw the AMA and the plastic surgeons change their position on mutilating procedures after the big verdict in New York. Do you think it's time that we be able to hold those who harm our children in this way strictly accountable?
It makes a lot of sense to me. The science is so clear that this is a harmful procedure with very little evidence of any benefits. We'll work with you on that.
No, I appreciate that. And the one talking point that these transgender doctors, I have a hard time even calling them doctors, but these quacks say is this is going to improve kids' mental health, prevent suicide.
Well, there's no evidence of that.
There's no evidence of that. And the Finland study showed that girls who are gender confused who undergo these procedures, their serious mental health issues double, and boys, they go up sixfold. So I think there's never been a good evidence, and now there's abundant evidence that we're doing more mental health harm than good.
I thank the gentleman.
Thank you, Mr.
Thank you,
Chairman.
Doctor.